Welcome all members of Independent Medical Practice, and I am in Chennai Metro branch. Today we have two speakers who are going to talk on two subjects. Arun and Dr. So is going to talk on ECG and Arun is going to talk on pneumonia vaccine. In fact, this meeting is sponsored by Pfizer vaccine division. So we also thank them for organizing this. First, before that, we thought we'll have a small program. It's very difficult for people to live beyond 100 years, generally. Particularly for a doctor to live after 100 years, very, very difficult, because most stressful thing is for doctors. We are the one who really, I've rarely seen doctors who have crossed 100. But here we have a professor of anatomy who has crossed 100 years last month. Please give him a big hand. July 20, he finished 100 years. He's completed 100 years. He's still active. That's the beauty, he's still active. He was my anatomy professor for my wife. For all, many of you, I think many of you, how many of you can stand, put your hands up for whom he has been? Yes. So many. Yes. So these, he has been our anatomy professor a long time before. I think in I'll just give a brief resume about him. Dr. Ramasamy, MBBS, MSc, Anatomy, FAMS, FIMSA. Born on 20th July 1924. Correct? 24. That's what I heard from you. Completed 100 years last month. MBBS from Madras Medical College in 1941. Even before KVT joined. 1941 finished, and 1947 when we got independence. That time we finished the MBBS. MSc Anatomy in 1958. Has been professor of anatomy in Madras Medical College, Stanley Medical College, KMC, Ramchandra Medical College, St. John's Medical College, Madurai Medical College. A very long stint he had been as a professor of anatomy. His appointment in various academic bodies is he has been in ICMR, National Board of Examination. Those days MNA, MS was very popular. National Board of Examination, Medical Council of India, Union Public Service Commission. Subsequently to his retirement, he took up interest in hypnotherapy. In fact, many of them know him as a hypnotherapist. I have heard one or two of his lectures in hypnotherapy. He is fantastic hypnotherapist. If he wants, he can make all of you sleep immediately. So easy for him. Okay. So he was the president of the Hypnotic Circle and senior member of the International Society of Hypnosis. His membership and fellowships in various academic bodies like Anatomical Society of Great Britain, India, American Association of Anatomists, various organizations he's been because those days very few anatomists were there. So he was one of them who really dawned the society. He was a fellow of the National Academy of Medical Sciences in 1998. He has numerous publications. In fact, I saw his numerous publications to his credit in Indian foreign journals, presented papers in national and international conferences. He is a guide for PhD in anatomy in various universities. He is a referee for Dr. B.C. Roy Award. B.C. Roy is one of the most coveted award in India, and he is one of the referee for it. Can you believe it? There are 4 or 5 referees and he is one of them. The prestigious award of the National Academy of Medical Sciences for his work in psychological rehabilitation of mentally afflicted. He got this award from the National Academy of Medical Sciences for psychological rehabilitation of mentally afflicted subjects through hypnotherapy. That was the award he got. It's the best senior faculty award from Shankar Nethralaya. He has conducted numerous workshops in hypnotherapy. Has been an examiner for MBBS, BDS, MD, MS, PhD, MNAMS, everywhere. Apart from all this, he was the cricket captain, staff team on the medical college. He is an excellent cricket player, and he was the captain for all the entire staff. On the top of all this, he is an excellent singer. I don't know how many of you heard him. He is an excellent singer. He has performed in AAR and various all medical meetings. There has not been a single meeting where he has not sung. In fact, I had the opportunity of singing with you once, sir. You might have forgotten it long time before. Okay, so with this introduction, please, we thought we should, our association should honor him with the Lifetime Achievement Award. 100 years Achievement Award. A ganglion is named after him. Oh, there is news. What is the ganglion named after you, sir? Ramasamy ganglion. Where is that ganglion? I don't know.
Which one?
In Gray's Anatomy, Ramasamy ganglion is there, is it?
No. You mean award?
No, ganglion. He says there's a ganglion which is named after him, given in textbook of anatomy. Okay, wonderful. Gray's Anatomy. Excellent. So we thought we'll honor him with the Lifetime Achievement Award. In fact, it's a great thing for him. He deserves it. He deserves everything. So let me request our president to honor him with a shawl first.
Sorry, I'll be sitting.
No problem, sir. 100 years you have the privilege of sitting. And this is the Lifetime Achievement Award which he gets from Independent Medical Practitioners. So this is the award, sir.
Is it okay?
It's okay.
I shouldn't cover my face. I shouldn't cover my face. It's okay. Thank you.
One which one?
My God. Oh, beautiful. Fantastic.
For internal injury, yeah. Okay. So you would like to say a few words?
Pardon?
You would like to say a few words?
Not too. How many minutes do you allow me? See, if I got a letter, from one of the students of St. John's Medical College, Bangalore. He wrote to me, it went online that I finished 100 years. I don't know from where he got the information. It highly advertised the 100 years reaching. When Mahalingam was in Venkataeswara, he has become a big shot now. So he sent home a correspondent from Hindu and from there was a TV. I always forget the name. What is his other name? There's a new channel that has become in the video. So they broadcast it on my birthday. So I gave all whatever I knew about whatever. Usually people ask me, what is your lifestyle for living for 100 years? Age is not, it's only a time. Even 120 golden days, Rishis lived for 500,000 years. But today I think the national death year, age for that is somewhere about, it was 50, now it is 70 or 80. Longevity has increased.
70.
So, I am very grateful for the honor you have done me by arranging this meeting and giving me this memento. I value this. I keep it in my office side room, or in office itself. I don't forget. He has asked me, how did you live for 100 years? Very many. What is the secret of your longevity? Today, my physical body is such that even the walker has become difficult. So I practice walking with the lifestyle. See, I practiced hypnotherapy after coming to Madras back from after 60 years. I learned hypnotherapy in Madras. I got interested in it. In Bangalore, I attended a workshop, and then the students were my sort of guinea pigs. I tried my hypnotherapy on them. I must thank them for enhancing my knowledge of hypnotherapy. Because attending a workshop is not the end, it's only a beginning. So one has to follow up. This is my policy, not just attend a workshop. So that hypnotherapy, hetero and auto hypnosis goes by very strong positive suggestion. First of all, you practice self hypnotherapy and then do the suggestion, very give powerful suggestion, even to the extent of talking to your organ and organ systems. You talk to them, they will listen to you. So, I talk to my heart and say, look, reduce your count, it will reduce. Like that, I am aware of every organ. Of course, sometimes they also rebel. That's different. So, I am a vegetarian. Even non-egg vegetarian. Egg is a vegetable as long as there is no embryo in it. So, unfertilized egg is vegetarian. Even that I don't know. When I was in Oxford, the person under whom I work, Dr. Bedell, he called me for his Christmas celebration. And I saw all over in Christmas, you find that animal's name all the way. What is that animal's name? This is my problem now.
Reindeer. Reindeer.
No. I'll tell you. It will take a little time. My problem is this. When I think of something, it will take a little 2 minutes to hop up from my unconscious to
Conscious.
subconscious, preconscious consciousness. To come to consciousness, it takes little time. So I say, I want this. I tell my brain, after 2 minutes it pops up. Sometimes it's a handicap. So I'll not talk about it much more. So one of the most important things is to take up something new, keep on adding to your knowledge, something new. For example, now I sort of play with the computer. That's my life now. I have also arranged for the notepad. You talk to the screen in a computer, it will go there, the letters will come. Laptop, not laptop, it is called
iPad.
No, I'll tell you. No, you talk to you just save the strain of typing. That thing will help you. It helps me a lot. You can send an email also. by just talking to the
Computer.
screen, it will type.
Yeah.
So, notepad, it is called voice notepad. Voice notepad. So you simply say it will work best. But the only thing it doesn't know is when I give a name, it doesn't give a capital. Only after full stop it gives the higher letter. So all are only what are called lower, not the capital but the small letters. So you have to use the computer, you can wipe it and then put on the right. So that is my life now. And my brain is still active because I go on adding new things, learning new things. So that is one. I'm a devotee of Bhagavan Sati Sai, who is no more now, who left his body in 2011. I was called for interview 4 times on him. 4 times. First time, he asked me, what do you want? See, I don't know how many people have got a Puttaparthi. There's a room where people assemble, and he has got a private room where he interviews you privately. So he tells you all about your life. It is very wonderful. He asked me, what shall I give you? What do you want? Sorry, what do you want? I said, your feet on my head. Kundalini Shakti. So, I don't know how many of you know Kundalini Shakti. I don't know. Yoga. I can't do yoga now. I had a fractured neck of femur, so replacement is there. So I can't do. But sitting down, you can do many postures. Yoga. People say, "Oh, I do yoga." They mean body. So, yoga is not just body. It takes you away to another world. Prana, yeah. Yoga is Ashtanga Yoga. Yama, Niyama, Pranayama, Yogasana, Dharana, Jnana, Shanti. So many are there. I do yoga, they say. Now, I was introduced to yoga by the paper which I used to be very fond of, Blitz, R.K. Karanjia. He is no more now. So Karanjia had written about one person, learned person in Srinagar. So I wrote to Bliss, will you please give me that person's Gopi Krishna. Gopi Krishna is his name. Well, will I contact you, give me address. I not only got his address, Gopi Krishna sent me 2 books on yoga, on Kundalini Shakti. So, these are the things which I think after I came out, I asked it to be on my head. But when I came out, he asked me, Bhagavan asked me, what shall I give you? Instead of saying, what do you want? He said, what shall I give you? He gave me a beautiful ring, Om. Om iti ekaksham Brahma, according to Bhagavad Gita. So afterward it broke. Then I asked Bhagavan, please give me another. He just gave a slap on the right side. I wondered why he didn't give on the left also. So, afterwards he gave me a Marakadam ring. So, I have full belief in him. Belief is the important thing. In the morning, when you wake up, the brain is very low in activity, and it is the time when people make decisions which many times are negative. So, the Americans had this problem of depression. There was one great author called Eddie Kuwait, I don't know whether you know. He just told, as soon as you get up in the morning, don't get out of bed. For about 20 minutes, you keep on saying, I'm getting better and better in every way, every day. I'm getting better every day in every way. For about 10 or 20 or 30 times, amazing positive thought take over. I gave an addition to this. Every morning, you go to the mirror and look to yourself and admire your face. So, according to Venkataeswara, when you see yourself in the mirror, you are seeing your own Atma. These are the things that sort of make life interesting. Kundalini, R.K. Karanjia first wrote negative things about Bhagavan Sati Sai. Then he had an interview, and after that he wrote, God is in this world, meaning Sati Sai. So they turned. So another 2 minutes I will stop.
Yes.
I think the knowledge of every doctor must know hypnotherapy. A learned first, a lay person, being Kohli, gave a talk in Dharmashala. What is that hotel? So he called any doctor here. He said he told a person who volunteered. He said this part of skill will become anesthetic for 5 minutes. He called anybody in the audience who is a doctor who can for beliefs. I went and attended. It was true. He had passed a needle through and through. The person didn't know during his hypnotic sleep. Then surprisingly, he called me. He said, you are a doctor and you don't know hypnotherapy. You must know. And he gave me morning breakfast in his hotel. Nobody will do this. They will keep a secret. So, a layperson, after that, I thought I should know psychology. My suggestion to all doctors is, read psychology. It must become a part of the curriculum. Every doctor must know psychology. I was in Bangalore for 8 years. I attended a function in get to the one yearly in NIMHAN, National Institute of Mental Health. There was an exhibition. I saw a book. The book title was Invitation to Psychology, not introduction. That that invitation attracted me. I read the book, I have got the book. I read many things. A good psychologist is one who never misunderstands. If somebody calls me a fool, I don't misunderstand. I say this man calls me a fool, or this women don't do that. Men don't. In conversation sometimes you're a fool. You're this thing. If there's some enmity which I don't have, then I start wondering, why is this man calling me a dull fool? There must be something in me he has found out. That's my reaction. And then, if what he thinks of me is not there in me, I said, okay, you can have that with you. I have no. If you call me a fool, you keep it. Don't worry. I know I am not a fool. I know what I am. So you must know what you want. These are the principles which I follow in life. Never misunderstand. Be a good psychologist. What does that do? I think even in Bangalore, I was going to a hotel like Woodlands. I turned without signaling. A motorcyclist crossed me, stood before my car, and said, "You, I forget the name, very vile word." I said, "Thank you, brother." Instead of getting upset, I said, "Thank you, brother." So he had to laugh and went up because, and I said, "Thank you, brother." That means he was also that he called me. I am not using the word. It will come. You bastard. This is my problem now. It takes a little time. You bastard. It turned. I don't know how many of you know this slang, you bastard. So I just laughed and said, "Thank you,
Brother.
my brother." So, what could he do? He laughed, I laughed, and the way. That Deepika Padukone has started a. You know Deepika Padukone?
Yeah.
You know, all of you know, nobody can know. He has started an institution in Bangalore. Live, love, love. So that is also nice. He went to, or many actors go through depression. He went to a very period of depression, got over it. So, morning you suggest whatever you brain is not very active at that time, it takes time. But many people make decisions in the நான் என்ன பண்ண போறேன் ஐயோ இப்படி ஆயிடுச்சு நான் என்ன பண்ணேன். Don't say all that. I'm getting and better. So another thing that I do, what I do and tell you. In the alphabet, letters of the alphabet, A, B, C, D, coin a word, 3 words, at least, in an alphabet letter, and give that as positive suggestion. A, letter A, attention, alertness, awareness. ABC, accept, bear, change. Any problem that you face, these are things I follow. I accept my problem. Yes, I have this. Now I can't go about walking this thing. I have to use the wheelchair. Yes, bear with it Change it if possible. Challenge it, change it. So ABC. A, alertness. Always be alert. I drop the things if I am not alert. Awareness. You must be aware. Alert. Attention. Your attention must switch. That there was a hypnotherapist who, when he started writing something, even his wife going out and coming in, he did not know. That is the limit. That is why you must train yourself. I do that. I train myself in my MNC association, alumni association. Before I went to St. John's, I sang Odu Nal Poduma Anpada Indaru Nal Poduma Marpa Nadama Gitama Idnat Pada Indaru Nal Poduma. In a picture, Shiva, on Shiva. So, the student, there was one person, his Balamurali Krishna's son was examining, I was examiner for him. So, somebody told him, he has sung your song. He came home. Balamurali Krishna came home. Similarly, I sang in KMC, Kanpudume Pira Kanpudume Ni Varalama Venkataeswara Meni Ura Kannu Teralama. Students, you ask me many times, sir, Kanpudume, sir, Kanpudume. I sang it when my younger grandson joined Kirpak Medical College. He is now an anesthetic in Apollo Hospital. So, EPS came home after that. These are events in my life which I can never forget. So, that sort of, my wife wanted to ask him whether he would take some coffee or not. And they were talking. I told, don't talk. He is very much engaged in writing something. He was writing all about S. Ramaswamy. In each letter he had written something. He told at the end, somebody with him told, once he gets it doing something, nothing disturbs it. The only thing that he knows is that. So you don't bother, you can talk anything, he will not know. That is the Milton Erickson had, and Rosie wrote a beautiful book on hypnotherapy, which I read thoroughly. So these are the ways. At the moment, I have the physical disabilities. You see, I am using the wheelchair. And not even walking sticks keep me steady. I can't even a few yards. I must start practicing a little more. So, but I'm 100 years and 30 days more, 34 days more. So I don't know. Lastly, it brought back to me a joke. When one grandfather, the grandsons used to celebrate his birthday. With every birthday, the grandfather used to say, "Thank you for organizing this. I may not be here next year." He will live 10 years more. But
so next year we'll call you, sir.
What I do is, if you come to my room, you will find lots and lots of
Books.
newspaper cuttings on the warrior, on spirituality, on culture, on politics. I write also to the newspapers. I like Modi, but people go back to Nehru. Oh, shoot. There are 2 or 3 authors who go on writing without mentioning Modi, they not complete. Modi Smarana. Same thing with this Rahul Gandhi. My point is, yeah, study. If there is a mistake, correct it. Why do you want to who thinks you must praise? Lastly, I used to read a book, How to Win Friends and Influence People by Dale Carnegie. His advice is be in your hearty in your observation, lavish in your praise.
Yeah.
If something good in people, keep praising. So that is all. I have given you an idea of my life.
Thank you,
The
sir.
thing is, always don't be attached to anything. That's non-attachment. Especially as you grow older. My brain is okay, my body is not. But that doesn't bother me. So I am sitting on the wheelchair today to address you. I used to do quite a lot of yoga and all that. So, ladies and gentlemen, doctors, I have talked to you quite a long time.
Yeah.
How many minutes?
20 minutes, sir.
20 minutes. I decided to talk for 20 minutes. 5 or 10 minutes. But I want you all to share. Because why did I say all this? Because somebody from St. John's wrote me a letter. I saw in the Hindu paper, I saw all online, I don't know, I saw online how he became, that you are that you have become a centenarian. So I wrote back to him, I've got lots and lots to tell you. It will take a long time. So I first acknowledge his letter and then told, I will tell you all about my own lifestyle, which will help everybody. So I talked about this. Thank you very much. All doctors,
Yes,
please
sir.
become hypnotherapists yourselves and study psychology. You are masters of your own profession, true. But also, please do this. So, every morning I tell myself, Bhagavad Gita, 18 chapters, at the end Krishna tells Arjuna, I have told you everything, you do what you like. He didn't say follow what I have told you. And Arjuna says, Gatosmi Sitoham Gatosmi Sandeha. All my doubts are cleared, I will do what I tell. But what happened at the end of the war, he was in a chariot. Bhagavan wanted him to go out with the chariot. You know what he did? You are a Sarathi, you must get out first. You see the ego? After 18 chapters telling everything, He did this. Krishna pulled him aside. What happened? The chariot broke to pieces. Bhishma's arrows were near. Krishna was stopping all of them. So, no ego business. Thank you very much for giving me this opportunity. Whatever I ever told you, I follow. Don't use the policy of the many of the politicians, not politicians, many of the politicians practice what I preach, but don't do what I do. Practice what I preach, what I tell you. Practice, and this thing must be the same. Thank you very much.
Thank you, sir.
I hope I have not what you call B-O-R-E-D. Thank you.
Thank you. Thank you.
That is how one should not end a speech. When I said it for fun. I never feel bored
with people.
And I should never say it. Don't get bored. Don't finish your speech with what I finished. Don't. Have confidence in yourself. Face always smiling. Then keep a smiling face. Receive cordially. Listen patiently. Talk very politely. In this thing, hypnotic circle, there is another thing. There was a talk, and I said this: receive with a smile, listen patiently, talk politely. He has put it at his entrance.
Thank you, sir. Thank you very much, sir. Thanks a lot, sir. Thank you very much. You will wait for the see me. You will hear
another meeting in 3 hours for him separately. I think the two speakers are there. I'm very sorry for the delay for everyone. Okay. Thank you very much.
கொஞ்சம் இது மாத்திரம் எடுத்துருங்க. We'll push this thing there, sir. Yeah.
Okay, record it.
Never went and your speech. I hope you are not bored. I know you have enlightened. This is optimism. You're always optimistic.
Good afternoon.
தண்ணி
Arun sampath is a senior consultant pulmonologist at Mayo International Hospitals. He is in the executive board of various medical bodies. Numerous publications to his credit. Contributed number of chapters in respiratory textbooks. Regular speaker in various conferences. Special invite in European Respiratory Society in numerous occasions. Huge list of academic awards he has gotten. I invite Dr. Arun Sampath to deliver the lecture.
I gave you my book. Give me the expansion. Give your the expansions of the payment.
Just ಇದು ಮಾಡ್ತಾರೆ ಅದು ಓಕೆ ನೆಕ್ಸ್ಟ್ ಅಲ್ಲ ಕೊಂಚ ಸ್ಲಿಪ್ ಅಲ್ಲ
Indian Medical Science Academy, ASI, Anatomical Society of light up. This thing, fellowship. Light.
Yeah.
All
you don't want this later.
Uh, it's my pleasure to be here, and I'm very much glad to listen to the wisdom and psychological philosophy of Professor Ramsamy. And I think I'm the odd man out here, and in a wonderful meeting organized by this IMA. So after post-lunch, there is a partial hypnosis, and Professor has already made it completely. I don't know. My job is almost over, so I can just finish it off quickly. So why we are here is not because Pfizer has organized. So this is one important topic which is very important. Even in spite of so much of antibiotics, we can treat this Streptococcus pneumoniae. However, almost if you see the globally, as per the WHO, 1.6 million deaths per year is being attributed to pneumococcal disease, and almost 1 million children are dying because of this pneumonia. The streptococcal disease. So this Streptococcus pneumoniae, otherwise called as pneumococcus, is a gram-positive diplococcal bacterium, and it has almost more than 100 known serotypes. So the serotypes, certain serotypes are more likely to cause the IPD, especially the 1, 14 and 19A. With the introduction of the PCV7 in the pediatric group, the vaccination program, after that, the pre-existing non-vaccine serotypes has been expanded, such as serotype 19A. So newer patients are getting with those serotypes which are not covered with this PCV7, and new serotypes were identified. So the ability of this Streptococcus pneumoniae to undergo the horizontal transfer makes it to have a genetic diversity and helps this organism to adapt the environmental change and to have a survival instinct in the presence of antibiotic selection pressure. And the prevalence of the antibiotic resistant Streptococcal pneumoniae has increased worldwide and might be related to the spread of pediatric pneumococcal serotypes. So the bug is becoming like a superbug, getting more and more resistant to the common antibiotics, and because of its inherent ability to have a horizontal transfer, it can develop a resistance to many antibiotics. For example, penicillin resistance can have a cross-resistance to the cephalosporins, quinolones, cotrimoxazole, and so on, even macrolides and so on, and hence we need to use the more toxic or the broad spectrum antibiotics just to tackle this disease. So the spectrum could be either a non-invasive such as sinusitis, otitis media, non-invasive pneumonia, or it could be invasive on the other side, invasive pneumonia, bacteremia or meningitis. Most often it causes the less severe disease. However, the invasive pneumococcal disease has significant mortality, almost up to 7% for the pneumonia, up to 30% for the meningitis. So who are at risk? Those adults 65 years and older are having a higher risk of pneumococcal disease, and across all ages, certain factors contribute to heightened risk of getting this pneumococcal disease, especially the invasive form, such as the immunocompromised patients, the splenic dysfunction or post-splenectomy, sickle cell disease, diabetes, nephrotic syndrome, chronic health diseases, cochlear implants, CSF leaks, which carries a higher risk for meningitis, and alcoholism. Even significant smoking are also at increased risk for this pneumococcal disease. So why vaccination is very important, especially to target the elderly? There are certain important features that happens as age advances, like immunosenescence. With age, deterioration in the functions of the immune system can happen, which lead to heightened susceptibility to the infectious and other neurodegenerative, cardiovascular, and autoimmune diseases. And there is another term called inflammatory aging. So we are all constantly having an oxidative stress, and that can lead to the subclinical inflammation as age advances. This can lead to a higher susceptibility to the infection and other chronic health diseases. And so the infection is one of the important cause of mortality, almost up to 30% in the elderly patients. And the infection can lead to aggravation of the underlying the disease and reduces the overall functional capacity. And especially in India, the vaccination program has been implemented in 1978. So most Indians who are more than 50 years at present of present time are actually not vaccinated. So the elderly population are uncovered with vaccines, and they need to be focused so as to prevent this invasive pneumococcal disease. And certain barriers are there because in India, especially the vaccine hesitancy is an important factor. It is not only on the population side or the patient side. Even the healthcare providers have their hesitancy to give them or educate our own patient and the other people about the importance of the vaccines. And the accessibility and the availability of vaccines is not uniform across all the parts of the country. And there are multiple guidelines which is confusing even to the healthcare providers, and the absence of national guidelines should be addressed. And these are the barriers where our Indian population faces with a sort of lesser immunization program, especially for the older adults. But if you take the pediatric, because of the universal immunization program, which is highly implemented in India, so the coverage of all the vaccines in the pediatric group is very, very good, but as compared to the older adults. So why is it important to prioritize the pneumococcal vaccination? If you take that overall, the invasive pneumococcal disease, almost up to 40% develop the significant disease such as pneumonia and meningitis. And the Streptococcus pneumonia is the important causative pathogen for the community-acquired pneumonia in adults, and even one of the important etiology for the acute exacerbation of COPD, acute exacerbation of chronic bronchitis. And the case fatality increases beyond the age of 50 years and can touch up to 30%. And in the invasive bacterial infection surveillance study, they have shown that 46% of those who have an invasive disease showed clinical worsening. So in a study where they found that as the age is increasing, the incidence of pneumococcal pneumonia hospitalization is significantly increased. You can see that, well, for the 50 to 64 years age group and beyond 80 years, there is a significant increase in the incidence of pneumococcal related hospitalization. And that is because of the well term called immunosenescence, or they have a reduced efficiency of their immune system and then the tackling of the infections. So the age-related decline in immune function leads to greater susceptibility to the infections. So there are other important comorbidities such as COPD, wherein the incidence rate was found to be 22.4 events per 1,000 persons years in the 10 years after the diagnosis of COPD. The incidence rate even crosses more than 50% in severe COPD patients. And even diabetes carries a higher risk of getting the pneumococcal disease up to 1.4 times. And surprisingly, even asthma patients across all age groups, they can develop higher risk of pneumonia, especially because of this Streptococcus pneumoniae. And smoking is also have a higher risk factor to develop, because the smoking causes the local milieu of altered immunology system in the lungs, and hence they can have a significant impact of the Streptococcus pneumonia. So you see, the Streptococcus pneumonia is also a type of commensal from the upper respiratory to the lower respiratory tract. But when there is a local immunity is reduced in the lungs, and that can lead on to a progressive form of infection, and that is alternative between the active inflammation such as bronchitis and then subsequent infection. The problem with the Streptococcus pneumonia, even if any patient we have the Streptococcus pneumonia, it's very difficult because most of the time we treat them with a clinical diagnosis. It's very difficult to extract or even in the culture because the representative sputum sample, most of the times we don't get it. And we may think that we are treating them properly because we don't get any sputum culture positivity or something. Sometimes we do not know the resistance pattern of this Streptococcus pneumoniae, and the patient might land up in actual significant prolonged hospital stay or even mortality. So among all the comorbidities, they have found that chronic lung disease accounted for 7.7 times higher risk of incidence of pneumonia, and asthma particularly 5.9 times because of chronic inflammation is going on. So because of the lack of pneumococcal vaccination, especially in adults, and the requirement of certain form of corticosteroid therapy, maybe inhaled corticosteroids, or sometimes the short burst of corticosteroids whenever the patient is developing an acute exacerbation, and these patients, usually the COPD patients, are in the elderly spectrum, and hence they have the higher risk of developing the Streptococcus pneumonia infection. So this is a Coley's vicious cycle hypothesis, where you can see one respiratory infection lead on to a bronchial inflammation, and this bronchial inflammation lead to the subsequent respiratory tract damage, and that weakens the host defenses, which subsequently increases the susceptibility to the further infection, and hence this is an ongoing loop from infection to inflammation, inflammation to the defect in the immune system, and then further increased infection. So that is the one reason, especially in bronchitis and COPD patients, they tend to get frequent infective exacerbations. And similarly, in the diabetes, if you see the diabetic patients, especially, they also have a certain sort of immunological alterations. They have a poor cell-mediated immune response, lower CD4 lymphocyte ratio, changes in natural killer function, and impaired leukocyte function. And also these diabetes patients, they may have a decreased antioxidant status, incidence of neuropathy, angiopathy, and they may have a large number of medical interventions. And all these contribute to the higher risk of pneumonia-related hospitalization, sometimes even touching 75%. And the International Diabetes Federation is predicting almost 783 million adults with diabetes by 2045. That is almost higher, 46% increase from this 2021. So coming to the pneumococcal vaccines, though this Streptococcus pneumoniae can be treated with the common antibiotics, still we have a large number of antibiotic spectrum. However, prevention is always better than the cure. So if we can target these elderly populations with the pneumococcal vaccines, we may have an impact on future health burden of the society. So at present, we have two vaccines, PPSV23, that is the polysaccharide. On the other side, we have a conjugate vaccine, PCV13. So just to touch upon, in your opinion, if there is a 66-year-old patient who has already received PPSV23 a year ago, but is now newly diagnosed with a medical condition increasing the risk of pneumococcal disease such as COPD, diabetes, or anything, does this patient require a pneumococcal vaccine again? Because he has received one vaccine, which is PPSV23. If so, which vaccine do you believe is recommended? So we will discuss about this. What is the difference between these two vaccines? If you see the conjugate vaccine on the one side and the PPSV23, actually the 23 have a larger number of serotypes in this vaccine as compared to the PCV13. So the PCV13 contains all the similar serotypes except the 6A, which is additional, which is not present here, but these PPSV23 have additional serotypes. But what exactly stands better? So if you see what is the exact difference is the addition of this protein conjugate. This is a non-toxic diphtheria-derived protein carrier, ARM190, which has been added to this vaccine as a carrier, and that leads to a longer term T-cell dependent immunity, and which has a good anamnestic response. So what exactly happens with the PPSV23 is it has an uncertain effectiveness for prevention against the non-bacterial pneumococcal pneumonia, and it has a hyporesponsiveness, and usually the response stands from say about 2 to 3 years, and after 5 years there is no protection by the PPSV23. And though it has been recommended for the adult and elderly population, but on the other side we have a conjugate vaccine which is PCV13, which giving a boosting effect of at revaccination. So one side we have a T-cell independent, which is an IgM antibody mediated immunity. On the other side, which is a T-cell dependent, which is a long time memory based vaccine efficacy. So this PCV13 has a potential efficacy in reducing the nasopharyngeal carriage and further reduction of vaccination impact in adults and elderly. So based on the sequencing, always follow like first give the PCV13 and then followed by PPSV23, and it usually is advised by 1 year, but in the presence of immunocompromised status like a bone marrow transplant or a patient who is having an ongoing chemotherapy or any active steroid intake or something, you can give PCV13, and the recommended is at least a gap of more than 8 weeks. Can we give together influenza and pneumococcal administration? Yes, both can be given. And regarding the COVID-19 vaccine, at least 14 days gap should be given. So why it is so important that PCV13 should be given before PPSV23? It is based on a phase 3 randomized double-blind controlled trial in the age group of 60 to 64 years, where they found that if PCV13 is given before PPV23, the favorable ratio, if you see all these are favoring the PCV13 and followed by the PPV23 as compared to the other side, giving the PPV23 then PCV13. So the initial administration of PCV13 followed by PPV23 elicits statistically significant greater immunological response for more shared serotypes. So what is the efficacy? This is a large study called Capital Trial, where almost around 84,500 immunocompetent adults aged 65 and older. So this is a controlled trial, and hence they have excluded the immunocompromising conditions, those receiving immunosuppressive therapy or those residing in long-term facilities or a nursing home. And this is they are immunocompetent adults and fairly very well represented population in Netherlands. And if you see the representative from all the major diseases has been there. So what they found that after the introduction of the PCV13, there is a significant reduction in the prevention of first episode of vaccine type community acquired pneumonia, almost up to 46%, and the prevention of a first episode of invasive pneumococcal disease up to 75%. That is fairly very important, and hence the efficacy is being proven, and subsequently this PCV13 is being one of the important immunization program across the world. So based on your clinical expertise, should a 52-year-old patient with well-controlled diabetes mellitus taking oral medications be considered as a candidate for pneumococcal vaccination? So before moving on, even in United States where the program is very much running, so what they found that age-specific and disease-specific immunization they calculated, where in the age-specific, all more than 65 years they are receiving the pneumococcal vaccination, but when they found that age-specific, the disease-specific, so even then the immunization achieved only 25%. So what they found that though they are recommending to the healthcare provider that the diabetes patient, COPD, asthma patients, or any patient who have a chronic health conditions or immunocompromised status, better offer them the pneumococcal vaccination. But even in the well-established countries, still they don't follow these guidelines. So why is it important? In our own diabetes patient, and now India is becoming or almost become the global leader in the diabetes population. So in this study where they found that the efficacy was very much comparable when the insulin dependent or the non-insulin diabetes, and almost 80 to 93% efficacy has been proven in diabetes patient. So the real world, the effectiveness study, where this study they have included almost 2000 population, and age above 80 years and immunocompromised patient was 46%. On all the important diseases were included, and even in the study, real world study, the effectiveness of the PCV13 was found up to 70% in the reduction of the hospitalization and the development of the vaccine type community acquired pneumonia. And similarly, it has been proven in COPD patients, and where they found that the need for ICU care and the ventilation stay and the hospital stay has been significantly declined. So these are the certain recommendations in global and the Indian guidelines as per the ACIP 2021 adult immunization schedule, and it has been clearly mentioned that the PCV13 can be given from the 19 to almost more than 6, because this is an adult, and in the pediatric group it is almost, it's fixed that about 6 weeks is being implemented in the common immunization schedule program. So what about our own Indian guidelines? API is recommending this vaccine anybody above 50 years. And from the Geriatric Society, they are recommending any persons above 50 years with the PCV13 followed by PPSV23. And the IMA in December 2018, and they have recommended PCV13 for adults above 50 years as single dose, and PPSV23 is recommended only for high risk population. And the clinical practice guidelines says that anybody above 65 years, please vaccinate with the PCV13 followed by PPSV23. And any patient who have an immunocompromised or any significant risk for the acquiring the disease such as cochlear implants or splenectomy patients are those, and please give the PCV13 followed by this PPSV23 at least 8 weeks later. And similarly, by the other guidelines on the diabetes mellitus, it has been recommended for the adults more than 50 years followed by the PPSV23 at least 1 year later, provided this patient has not received PPSV23 within 5 years. So this, all the guidelines is giving the importance or the stress to vaccinate our individuals at least above 50 years. And I'm just coming to the terminal part of my discussion where, so in United States, they have followed from 1998 to 2017, and this data is being collected now even until date. So where they found that if you see the incidence of all invasive pneumococcal disease with the introduction of PCV7 in the children, they found, and this is, they have introduced in children, but this all this data is above the adults above 65 years. So those persons or children who received the PCV7 way back before 2000, and now it's been seen even in the adults, the immunococcal, the invasive pneumococcal disease is significantly reduced. So what does it mean? So when we vaccinate the younger population, so the carriers are reduced, and so the adult or the geriatric population is also supported. But what exactly is actually showing is, but you can see this, there are so many serotypes which are not covered with the PCV13. So the non-serotypes gradually slightly increased even after the PCV13 is introduced. So there is a need for including of more serotypes in the vaccine, the conjugate vaccine. So what if the serotype coverage of PCV is increased beyond 13? So now PCV20 and PCV15 got FDA approved in June 2021. We may get in near future in India. So if you see the PCV15, the 2 more additional serotypes and PCV20 and almost other serotypes have been included. So in US and other abroad countries, they have introduced this PCV15 and PCV20 for adults in mid 2021, and subsequently PCV15 in mid 2022, and now in later to 2023 PCV20 is being started to implement in children. So there will not be any confusion in near future. Only one vaccine, no need for PPSV23 something. So if we are going to get this PCV20, then there will be only one vaccine, one shot. So the latest recommendation says that CDC recommends PCV15 or PCV20 for the younger children less than 5 years and 5 years to 365 years with certain risks who never received a PCV, and all the adults above 55 years should receive the PCV20. And the CDC still recommends PPSV23 for those children with certain risk conditions who get PCV15, but if the children receive PCV20, there is no need for additional vaccination. And the previous recommendation still stands value. If any adults who have received PCV13 after 1 year receive PPSV23, there is a conditional recommendation can get PCV20 again. So this is all about the vaccine and how to improve our own adult immunization program, because we all talk much but do less. So there are a lot of barriers to the adult vaccination. The pediatric vaccination is well programmed, but adult vaccination is we healthcare providers should bring the concept to our own patients. So I start recommending the patient definitely have vaccine hesitancy. So during each visit to educate them, and also any other attenders, the bystanders who are also the elderly population, I also start telling them that the importance of the vaccine. Similarly, the newer vaccines are coming like RSV, the shingles vaccine. So we need to educate the elderly population with all these vaccines, the importance of the vaccines. So there are a lot of the guidelines which are confusing, and the recording systems are missing. So first we need to educate the healthcare providers and educate the public. So collaborating towards the establishing vaccine centers in both in government centers and in the corporate centers. So we can have it is not easy to convince the private organization to have a separate vaccine centers, but if the NABH guidelines or any guidelines start implementing this, the importance of the separate vaccine centers, then that will be helpful. So all specialties and stakeholders have an equal role. It is not only stops with the physician, even with the surgeons or any other specialty, gynecologists, everyone should also recommend the importance of this pneumococcal vaccination or other vaccinations whenever they are facing with the elderly patient or the bystanders. And the could be dedicated to an adult vaccination in CME conferences and public awareness programs. Some day can be recognized as a vaccine day. So in the busy practice, it's not possible for each and every time we do ourselves. We can take the help of some specialized counselors or even our own some other technicians like allied physicians, like a dialysis or PFT technician could be part of the vaccine program, and even the intensivist or the emergency medical care, whoever can actually tell the patient and the bystanders or the family members the importance of the vaccine, so that another exacerbation can be prevented, which can help them from the financial burden in future. To summarize, the elderly individuals face a notably elevated risk of contracting this infection, and especially the chronic lung disease, the COPD, the incidence of community-acquired pneumonia was at least 40% higher risk as compared with the other non-COPD patients. Diabetes patients faces a higher risk of getting this pneumonia, almost up to 1.4 to 1.6 times higher risk. And the pneumococcal vaccination is recommended for all adults aged 65 years and older, and as well as all the adults less than 65 years with certain factors or the comorbidities responsible to develop the severe complications of this pneumococcal vaccination, pneumococcal infection. So the benefits of the PCV13 persist over 5 years, but in PPV23 vaccinated individuals, the effect declines after 2 years. Hence, the PPV23 is having a little or even lower immunogenicity and immune efficacy as compared to the conjugate vaccine. So the global and Indian guidelines recommend PCV13 vaccination for higher risk individuals due to superior immunogenicity compared to PPH23. I'm not here to compare only two vaccines here, but we need to educate ourselves and also educate our patients and others. So with this, I thank you all for your patient hearing, and I thank Kailash sir for giving me this opportunity.
I just have a small doubt, like many of you here have taken PCV13 vaccine. All of you have taken, all of you raise your hands who have taken PCV13 vaccine. Because I thought I'll ask the company if they can, the cost of the vaccine was 4,400 or something like that. If you have 30 people, including our family members, then we bring it down to less than 3,000. So PCV13 is good. So where is Veera or you? Veera, okay. Can you bring it down to less than 300, so 3,000, so that around 3,000 where about 30 people, even our family members can come in it. Even if our family members abroad, if you have 30 of them, then you can bring it down. So anybody is interested, so please give your name so that we can have a group of 30 people, then contact them for this PC13. PC13 is the best vaccine for nothing to be. But what my doubt is, what if we conjugate PCV23 with the protein so that the whole thing will be cheaper? No? PCV23 is cheap, so you can bring a 23 conjugation. 20, they're getting 20 now with conjugate. Okay, that is more than enough. Yeah. Fine. So maybe this we can organize through IMA or independent medical practitioners. Please give your names to Rahul. How many people? If you get 30 people, then we can try it. If you can make it 20, it will be fine. 30 means he told me 30. So if there are 30 people, we can always get this. Okay. Thank you. Madam, please honor the speaker. Any more questions? PCV 23. New 23 and all that. This is other than the different companies. Many companies are called 23, but 13 only Pfizer has got.
Pravanar 13.
Pravanar 13.
Pravanar 13.
Antigenic prevalence. Sir, Dr. Arun, he wants to know what is the antigenic prevalence in Indian standards. In comparison to 23, has 13 got all the antigenic prevalence in India?
Sir, I couldn't understand.
Antigenic, for example, some people say 3, 6, 8, 19A like that, which is
What is most
Most prevalent in India.
No, we don't have data, sir. But what they say, yes, sir, what they say is that the spectrum of disease is different. See, some serotypes causes the meningitis, some serotypes causes the other invasive pneumonia. So this 13 has been developed by the evolution of the important, because it's more than 100 serotypes. So what they said that whichever is common serotypes, they have started including. So from 7 they have increased to 10, then 13. Now they have moved on to 20. So that doesn't mean if a person receives the PCV20 also, that doesn't mean the patient cannot develop other serotype related disease. So these are the prevalent common serotypes causing the invasive pneumococcal disease. So we want to prevent the invasive pneumococcal disease which have higher comorbidities, higher morbidities and mortality. But that doesn't mean the particular patient will not develop sinusitis or their non-invasive disease. So this vaccine, they want to intend to prevent the complicated diseases. So whatever we have is based on the Western data. So we don't have a specific data for which common type is causing one particular disease.
some people claim the cross immunity between 6A, 9A, 6A and 6B. Like that, is there any truth or some validity in such state?
Cross immunity, I couldn't understand. I understand, sir, but I don't know the data about that cross immunity between these two serotypes.
Those who are not having that particular antigen in their vaccine, they claim that this particular antigen can act against the other antigen also, which is missing in that particular
So
vaccine.
that's the reason when the recommendation is you give PCV13 In order to cover the other 10 serotypes also, they are recommending after 1 year you give another dose of PPSV 23. And why PPSV 23 we can use, because it is a larger number of serotypes. So why can't we use that straightforward? So the study says that the conjugate vaccine, the immunogenicity is much higher and has a boosting effect on the PPSV 23. So you give PCV 13 and the remaining 10 other serotypes will be covered by the PPSV 23, though with a lesser immunogenicity, but this PCV 13 boosts the immunogenicity of the remaining serotypes also. So now Prevnar 20 is available. So where they included from 13 to 20. So the latest guideline as per the CDC says that PCV 20 one dose is enough. But that is not possible in India because the coverage of vaccination from the younger population is still missing. So PCV 20 one dose is still problematic. So no, for more than 65 years, one dose is enough. Children. No, they are included in the immunity program 6 weeks and above.
6 weeks and above?
Yeah.
What shot is that?
No, that is as per the, that is why 3 doses and everything.
Same like
6 weeks, 10 weeks and 14 weeks. Same, that is been included in the immunization program. So they are replacing the PCV 7, then PCV 13, now PCV 20 in all the immunization program. And India definitely, when Prevnar is available, I think our immunization, universal immunization program will start implementing the PCV 20 also.
So PCV 20, Prevnar 20 is conjugate only.
Conjugate.
in adults above 65, one dose is sufficient.
At present,
5 to 10 years immunity surely.
yes. At present, the recommendation is PCV 13 first, and followed by PPSV 23 after 1 year. That's all. And there are certain problems if you want to vaccinate in between from 19 years to 65 years who have a chronic health disease, where the years are very high. Still, I don't know. They will say that PCV 13 is best, but we do not know after 5 years. So you can still tell them to vaccinate after 5 or 10 years with the PPSV 23 again. And those who have a significant risk factor like splenectomy, we can't say that you do give 1 dose or 2 doses and stop it. You please get it renewed by at least 5 to 10 years with PPSV 23. So those who have a higher risk factor, we can't stop, like a bone marrow transplant or any other significant immunocompromised patient, and they are surviving even beyond 5-10 years, they have to renew with the PPSV 23 again.
So the thumb rule is first 13, followed by 23 as and necessary after 5 years. Every 5 years also. Yeah. So give a big hand to Dr. Arun. Thank you, Dr. Arun. Please hand over memento to Dr. Subhash.
Excellent.
பேசும்போது 2 photo எடுத்துக்கணும்.
On behalf of my employee, I would like to present this.